Emergency departments see a predictable surge in cardiac events during winter holidays, particularly Christmas Day and New Year's Day. While stress and cold weather contribute, one often overlooked factor is the holiday feast itself. Large, rich meals create acute cardiovascular stress through mechanisms that are surprisingly potent and entirely preventable with awareness and moderation. Understanding postprandial, after eating, cardiovascular physiology reveals why the celebratory dinner table can become the site of tragedy. When you consume a large meal, particularly one high in fat, your body mounts a complex metabolic response. Blood flow redirects to the digestive system to support the massive task of digestion and absorption. Your mesenteric arteries, which supply the intestines, dilate to increase blood flow to that region. This means less blood is immediately available for other organs, including the heart. For someone with limited cardiac reserve due to coronary artery disease, this redistribution of blood flow can create relative ischemia, insufficient oxygen delivery to heart muscle. Postprandial lipemia, the presence of fat in the bloodstream after a high-fat meal, impairs endothelial function for 4 to 6 hours. The endothelium, the cell layer lining blood vessels, normally produces nitric oxide that keeps vessels relaxed and prevents clot formation. After a fatty meal, this protective function is temporarily compromised. Vessels become more constricted, blood becomes more prone to clotting. Studies measuring arterial function before and after meals show measurable impairment that peaks about 4 hours after eating. Insulin surges in response to carbohydrate-rich meals can trigger arrhythmias in susceptible individuals. Large fluctuations in blood glucose and insulin create electrolyte shifts, particularly of potassium, that affect cardiac electrical stability. This is one reason why Christmas dinner, with its multiple courses of rich foods and desserts, creates more risk than an ordinary meal. The sheer volume and richness of food creates metabolic stress beyond what the body typically handles. Alcohol consumption during holiday meals compounds all these effects. We've already discussed alcohol's cardiovascular effects, but in combination with large meals, the risks intensify. Alcohol metabolism competes with fat metabolism in the liver, potentially prolonging postprandial lipemia. The vasodilation from alcohol adds to the blood flow redistribution from digestion. Holiday heart arrhythmias become more likely when alcohol and large meals combine. Behavioral patterns around holiday meals add additional risk. Many people eat until uncomfortably full, far beyond normal satiety. The physical distension of the stomach can stimulate the vagus nerve, triggering abnormal heart rhythms. Lying down shortly after eating increases gastroesophageal reflux, which can cause chest discomfort that's difficult to distinguish from cardiac pain and can also trigger vagal responses. Physical activity after meals, whether dancing, playing games, or even vigorous conversation with gesticulation, increases cardiac demand at a time when the heart is already stressed. The timing of holiday meals often coincides with other risk factors. Christmas and New Year's dinners frequently occur in the evening, which is better than morning from a circadian risk perspective, but they occur during winter when baseline cardiovascular stress is elevated. They occur at the end of busy, stressful days of preparation and family dynamics. They occur in the context of disrupted routines, missed medications, excessive alcohol, and sometimes inadequate sleep. All these factors converge. Prevention doesn't require skipping holiday celebrations, but it does require moderation and awareness. Portion control, even of special foods, reduces metabolic stress dramatically. Eating slowly and stopping at comfortable fullness rather than stuffed fullness makes a difference. Balancing rich foods with vegetables and leaner options moderates lipemia. Limiting alcohol or spacing drinks over longer periods reduces combined alcohol-food effects. Post-meal behavior matters. Remaining upright for at least 2 hours after large meals reduces reflux and vagal stimulation. Gentle walking aids digestion without creating excessive cardiac demand. Avoiding intense physical exertion or stressful activities immediately after eating gives the cardiovascular system time to handle digestive demands. For those on cardiac medications, ensuring medication adherence despite holiday disruption maintains baseline protection. Symptom recognition during and after holiday meals is crucial. Chest pressure, pain radiating to jaw or arm, severe shortness of breath, these aren't indigestion. They're potential cardiac emergencies requiring immediate evaluation. The tendency to attribute symptoms to overeating and wait to see if they resolve leads to dangerous delays in treatment. Family members should be educated that if someone develops concerning symptoms during or shortly after a holiday meal, particularly someone with cardiac risk factors, immediate medical evaluation is warranted. The holiday can continue after ensuring safety, but life-threatening events cannot wait.